Doctors have warned a dip in health screenings during the pandemic could lead to an increase in missed cancer
And
cases.
today we have new information about those numbers and the one cancer in particular that is causing alarm. KXAN morning anchor Sally Hernandez has this in-depth interview.
Dr. Kamal with the American Cancer Society, thank you so much for talking to us about this today. I want to go ahead and start with the numbers that we're getting from the American Cancer Society. And it's talking about how during the pandemic in 2020, colorectal cancer screenings in particular dropped 90% in some settings.
Yeah, that's remarkable. That's remarkable. And what we worry about, right, is that for a lot of things in healthcare, it's a habit, right? So it's a habit to go to your primary care physician. It's a habit to go to your dentist. And for many folks, we got out of habit during that time because we put a pause on non-emergent healthcare concerns. What I'm here to do is make sure all your viewers and listeners understand that we need to get back into the habit of doing this.
What do you think is the reason behind that drop? Is it a misconception about who's getting this type of cancer?
There is. So what we're starting to see is a trend towards younger people being diagnosed with colorectal cancer and having higher risks of death. So when people think about colorectal cancer, I think the average thought is someone who's in their 60s or 70s. And for oftentimes we see people waiting to get screened until that time. What's happening is then we're seeing more people in their 40s, and I'm an oncologist, I see those folks as well, 40s and early 50s as well. So I highly encourage all of us to, the American Cancer Society, 45 and older. The moment you turn 45, you should really say, this is something I should get done.
Along the lines of those really surprising numbers, the American Cancer Society is also saying that more than 150,000 people will now be diagnosed with colorectal cancer, and more than 52,000 will die from the disease this year because they missed those screenings.
Now is a good time to get back to screening, particularly because delays in screening we know can lead to cancers popping up, particularly later in their course, and they become more difficult to treat. And colorectal cancer is a really good example of where catching it early means a really high rate of cure and hopefully never having to think about it again.